blockade of the sweat duct in the skin. Depending on the level of blockade, there are 3 types of miliaria. When the ducts are blocked close to the skin surface, you will get a miliaria crystallina. Further deep down, that is in the mid-epidermis, you will get miliaria rubra, and deep down at the level of dermal-epidermal junction, you will get miliaria rubra. Among these, miliaria rubra is the commonest type of heat rash. Now we will see who gets this miliaria or heat rash. Children and about 30% of the adults who are exposed to excessive heat and humidity or who suddenly moves to a tropical climate can develop miliaria. Then hospitalized patients, especially those who use waterproof mattress and all, they can develop miliaria. And even newborn babies, especially in them, their sweat ducts are immature, so it can easily get clogged. They can develop miliaria, especially miliaria crystallina. Now, how it presents or how the patient will recognize miliaria. So miliaria crystallina, as the name shows, it will present as a very superficial blister with a clear fluid. It looks like a beads of sweat, and it easily subsides without much inflammation, leaving behind some scaling. Miliaria rubra, patient usually experience very much itching sensation or prickling sensation with some red rash, and usually comes in the neck and folds in children, and in adults it usually comes in the neck, upper part of the body, and even in the skin. We will see what are the tips to prevent this miliaria, or what are the first aids you can take to prevent this miliaria. Our main aim is to reduce excessive heat and humidity. So staying or working in an AC room at least for a few hours in a day is very much helpful for you. And second thing, you can use cold compresses or take a cold bath. And regarding the clothes, better use loose cotton clothes, and even synthetic fabrics also. Some breathable synthetic fabrics are available that you can use, and avoid very strong soaps and irritants to the skin. These are very much helpful, and especially in case of babies, you have to avoid more layering because we have a tendency to cover with more clothing that we have to avoid. Then next question is it important to consult a doctor if the miliaria develops, or if the miliaria is not improving with your first aid measures? I'll say definitely yes. First of all, miliaria is an indication for your impaired heat regulation, so we should look into that one. And second thing, miliaria can develop some complications like secondary bacterial infections, which we call as periporitis. In that case, we need some antibiotic treatment also. And apart from that, sometimes this miliaria may be mistaken for some other skin disease like a bacterial infection, fungal infection, even a herpes simplex infection. And not that common still, some rare drug reactions like LGEP can mimic miliaria. So if the miliaria is not improving with this first aid measures, definitely you should consult a doctor. Now, what is the treatment for miliaria? The first and foremost important thing is avoid excessive heat and humidity. And we can use some calamine lotion to reduce the discomfort, but the problem is it may be a little bit dry, so you have to use an inhalants. Then vitamin C is found to be helpful. If there is severe inflammation, we can go for topical steroids. As I said earlier, if the patient develops some secondary bacterial infections, we have to start some antibiotics also. With this approach, most of the cases we can treat very well.